The World Blood Donor Day is celebrated every year on the 14th of June. For this year, the theme is A Drop of Humanity, Give Blood, Save Lives. The aim of Blood Donor Day is to celebrate the voluntary, altruistic, and repeat donors who give blood to provide safe, sufficient and sustainable blood in our blood banks. And this saves the lives of those that need it, such as sickle cell disease patients that are repeatedly transfused, patients undergoing cancer treatment, and patients with trauma, either from accident or any other cause of trauma. Donation from one person can go beyond just saving one life. It can save many more because you can fractionate blood into its various components: red cells, platelets, cryoprecipitate, or fresh frozen plasma. For each of these components, there are specific indications that provide the need for such components, such as bleeding and other hematological disorders most of the time, and maybe platelet abnormalities and the like. We need 2 million, but we just collect less than 30% of our needs. So it's almost like 500 to 600,000 units. So we have a large deficit. And many of the deficit is usually closed by a donation from family relations. And this does not give us the safety and availability such that anytime somebody comes into the hospital, you seek for family to come and do all the necessary tests. It doesn't give you the required emergency for which most of the time blood is needed. So it doesn't close the gap of needing in emergency. Even though most of the family donors are family replacement, because you may donate for a family, but that blood does not necessarily go to that family. It may be replaced in emergency from what we have banked in our blood banks. Most of the time, especially for knowledge and attitude, it has been shown that many people have fear or myths surrounding blood donation. I don't have enough, and not having enough will not even allow the personnel to bleed a patient that doesn't have enough, because we ensure safety for both the donor and the recipient. So a donor is not qualified to donate unless he meets certain criteria, including laboratory testing to make sure that that donor is safe for himself and for the recipient, including checking the blood level, including checking infections that may be transmitted to the recipient. We do ensure that the donor is safe and the recipient is also going to receive safe blood. Blood donation is not just medical, but it is a collective expression of solidarity, compassion, and responsibility to human survival.